Our keynote speaker today, and I have to say, he doesn't know this, but Dr. Cantu calls my cell phone on a Friday. And I answer my cell phone because I don't know his cell phone at that time. And I answer my cell phone and he says, "Hello, this is Dr. Cantu." And I actually did this. And then I said, "Hello, hi, how are you?" Like it was nothing. Because in my world, Dr. Cantu is a star. It was like Justin Timberlake calling me or something. So that's how I started off this whole thing. And I'm going to read Dr. Cantu's bio. It's scaled down. But he's pretty amazing, and we're so lucky to have him. Dr. Cantu's professional responsibilities include those of clinical professor, Department of Neurosurgery, and co-director of the Center for Study of Traumatic Encephalopathy, Boston University School of Medicine. He's the senior advisor to the NFL Head, Neck, and Spine Committee. He is the section co-chair of the McKay-White, the National Football League Players Association Traumatic Brain Injury Committee. He's the co-founder and chairman, Medical Advisory Board of the Sports Legacy Institute. He's an adjunct professor of exercise and sports science and the medical director for catastrophic sports injury research. He has written 32 books and hundreds of articles on concussion and is one of the foremost experts in the field of concussion research and treatment in the world. He will be signing books after. We do have books that will be signed by him after the keynote. And it is my pleasure to introduce Dr. Robert Cantu to you.
Thank you, Lisa. Lisa, thank you very much for that very kind introduction. And I want to thank all of you for taking time out of your busy work week to be here today so that we all can perhaps learn a little bit more about concussion and all of us be a little bit better in treating our patients as a result of that. I also want to thank the Lisas, and especially Lisa, for putting this meeting together, because I know how hard it is to put together medical meetings, especially the first time out of the box. And this is just a marvelous turnout. So I suggest we give Lisa a hand. Since we've been asked to do this without audiovisual stuff, the PowerPoint that we normally talk with, I feel a little bit like I'm unclothed up here. But we'll try to keep to the agenda, and I'll try to keep my mind on track. I thought what I might do is just simply very quickly skim through 41 years of experience with concussion, athletic concussion, and kind of give some highlights of where we've been and where I think we need to go in the future. For me, this all began 41 years ago when, after 5 years of academic neurosurgery at Mass General, we found ourselves having taken advantage of the Hill-Burton Act to set up a neurosurgery department at a suburban Boston hospital, Concord, and found ourselves away from the constant research and the constant writing of papers that we had done for all of our years of training prior to medical school, and then residency, internship residency, and then the 5 years at Mass General. And we found ourselves, though, on the sideline of high school football fields as a team physician for a local high school. And so what better laboratory to study brain trauma than a high school football field? And obviously, being a neurosurgeon, I focused on neurologic issues, focused on primarily the most common of all, head injuries, concussion, and to a lesser extent, cervical spine injuries. And that's kind of been my life's work over the last 41 years. And 41 years ago, there was something known about concussion. In 1 year before I was born, in 1937, the College Football Coaches Association basically said in their document that kids were being returned too soon after concussions. They were being returned symptomatic rather routinely. Well, guess what? In 1973, that was still true. In 83, it was true. In 93, it was true. And, you know, it's almost still true today. It is true in many instances today, hopefully fewer than, say, 10 or 15 years ago. So back in 1973, not a whole lot of interest was there in concussion, and there really wasn't anything to guide the most basic of all things, which is when should an individual go back to playing a collision sport after suffering an athletic concussion. And athletic concussions, as you all know, are not the same thing as concussions that are sustained off athletic fields in terms of the return to play part of it. Because when you return to play, obviously you're subjecting yourselves to more trauma. So you need to be more completely recovered than somebody who might be going back to a job where brain trauma is not an issue. Out of that, we decided that we would do the necessary research, study the world's literature, try to come up with practical guidelines based on our own experience for when people should go back to play. And in 1986, that was published as the first return to play guidelines after collision sports, after football. And the hallmark of it was basically that the athlete needed to be asymptomatic first at rest, and then after exertion, the athlete must not be having any post-concussion symptoms provoked. So they need to be asymptomatic first at rest and subsequently at exertion. And that was the basis for the return to play guidelines in 1986. They were not evidence-based, they were personal evidence-based. And we have guidelines that are fairly similar today that we've been very humbled to be a part of, the 4 international concussion and sport groups, Vienna, Prague, and 2 in Zurich, that have put together concussion management principles that are consensus statements. They're not necessarily perfect. They will need to be modified over time. They already have been somewhat. The 2004 Prague guidelines, which suggested that we could talk about concussions as simple and complex based upon how long the symptoms lasted, quickly got changed in 2008 when many of us felt very strongly there's no such thing as a simple concussion and none should be thought of in those terms. And then in 2008, we suggested return to play should be, when I say we, I think it's important to understand these consensus guidelines are consensus of the authors. And just because your name is on a paper doesn't mean you agree with everything in that paper. You better agree with more than 51% or you should take your name off of it, and we've done that off a number. But I've left it on others where I don't agree with everything in it, but I agree with most of it. And in 2008, over our objections, the guidelines that came out of the first Zurich conference was that you could return individuals to the athletic playing field after a concussion, as long as the symptoms had cleared and they were asymptomatic at rest and exertion, the same day if they were at the college or professional level. Because we had people as a participating in that consensus that represented the NC2A, that represented National Football League teams. But if you were 18 years of age or under, you could not return the same day. Well, in 2010, the National Football League made all of that obsolete when they themselves, and I'm pleased to realize that they did this, basically said that any athlete, any NFL player, where a concussion cannot be ruled out, or if they're diagnosed with a concussion, cannot return to practice or play the same day. And so when they did it for their players, within a matter of 2 months, the NC2A lockstepped and the National Federation of High School Football Associations did a number of months later as well. So now it's kind of law across the land that anybody that's diagnosed with a concussion is out that day, cannot return to practice, cannot return to play, should not be returned until a medical professional has deemed it appropriate for them to return. And basically now we have laws in all 50 states that pretty much mandate that. And I think that's a tremendous accomplishment. What needs to be done in the future is funding those laws, because those laws are really a blank mandate, an unfunded mandate. So they're really not putting feet to the fire, but at least they are educating about what is the proper thing to do. Well, after having been a part of all of these concussion in sport consensus statements after being a part of both of the ACSMs and the National Athletic Trainers Association concussion guidelines. If I didn't already know it before, I certainly learned it firsthand that there are political agendas that do exist in this world. There are egos that do exist in this world. And so I want all of you to never be fearful of if something that you read doesn't ring true to what you are experiencing in your professional experience, in your personal experience. Question it. And if it means being more conservative, be more conservative. Because there isn't virtually anything that has ever been put together that's absolutely 120% perfectly perfect in every instance. And even if it is at the time, over time, science is constantly evolving, and it will probably not totally be true at some point down the road. And if you're looking at things and not looking at it in that light, I think you can be making some mistakes. We kind of kept this path going with writing about concussions, talking about concussions, because of the work that we did with the American College of Sports Medicine and eventually becoming a president of it and then an ambassador for it, on and on and on. A lot of opportunities opened up, and so we were able to do this, but virtually all of it was in front of medical audiences. Athletic trainers, coaches, nurses, the composition that's in this room, physicians of various specialties. We kept preaching essentially to the choir. And then in 2003, something happened that was going to change quite a bit the way we viewed things. We had a young, very tall, very attractive, very bright, charismatic, former Harvard football player come to the office and be seen because of post-concussion syndrome. At the time, he was a professional wrestler with WWE. You all know him, Chris Nowinski, I'm sure. Chris was in the throes of a very severe post-concussion syndrome, one that he would take 5 years to really get over. As a result of the amount of symptoms that he had, even though they were improving, we gave him the advice that he could never return to anything as potentially dangerous as professional wrestling, which, as you all know, is scripted, but the scripts involve acts where you're off a millisecond and you do indeed take trauma. And in fact, way back in his day, they really were stupid enough to be slapping each other around with real chairs and other real devices too. Chris's background was kind of interesting because he'd been in reality TV, he had been in WWE, so he was kind of a rock star, and he was leading a rock star's life, and he loved it. And any of you who know him realize that's his personality. He kind of really is driven by that. And when I gave him the news that I felt I had to give him, I kind of worried about how he might take this and what he might do. And what he did has been nothing short of miraculous. Because rather than sitting around feeling sorry for himself, he plunged into learning as much as he could possibly know about the subject of concussion and post-concussion syndrome. And because he had worked at a position where researching the literature was what he was doing for a job, he knew how to do this very effectively. And he really accumulated a tremendous amount of knowledge. And as we would see him from time to time, eventually he came back and said, "Bob, what do you think about me writing a book about my experiences and putting in the book experiences of some others?" And I said, "Chris, I think that's a great idea." And I was mostly thinking about this because he really could give a peer version of information to athletes that I thought he could relate to very well. And with our experiences at the NFL, we were able to put him in touch with a few beyond the high school and college arena that he already knew, and those individuals became a part of the book as well. The book is called Head Games, and as you know, it's been made into a movie which stars Chris, and has been very instrumental in getting the concussion message out, I believe, especially to our youth. Chris came to me in 2006 and basically said, Bob, what do you think about an idea of forming a not-for-profit organization which will help to try to solve the concussion crisis, will help to promote concussion awareness? And what Chris was allowing me to understand, and what I learned after the meeting in 2003 with him, is that I could go around to medical meetings forever, which I still do, probably more than ever before, and other meetings as well, but the medical meetings alone, and Chris could get a message out through the media that would be seen by millions and millions of people, not by a very important 100 plus people that are in this room, and that's why I'm here, because we're all here together. But Chris knew how to use the media. He had cultivated it through his reality TV and WWE exposures, and he essentially was taking the concussion message, educating writers, the foremost of which was Alan Swartz, that almost won a Pulitzer Prize for his marvelous articles for the New York Times on concussion, and also his experiences and exposures with many different people in the TV world that led Chris and subsequently others of us to be involved with using the media to get the message out. Well, in 2007, we formed Sports Legacy Institute to essentially promote concussion awareness as an advocacy organization and also support concussion research, prevention, treatment. 2008, we wanted to come up with a way of continuing the work in terms of we needed a brain bank to study brains that Chris would be able to obtain through his own efforts with deceased athletes. And we looked around various places, and we were obviously thinking it would be nice if it could be in Boston, because that's where we were essentially. And we found it. And we found it at BU. And in this room, you're going to hear today from somebody who was instrumental in setting up the Center for the Study of Traumatic Encephalopathy. He was then head of the research area in the Alzheimer's Disease Center at Boston University. Bob Stern's his name. You're going to enjoy immensely his work and his talk in the breakout session. Bob is the one that was responsible for going to the dean, meeting with the lawyers, making this collaboration happen between SLI and Boston University that became the Center for the Study of Traumatic Encephalopathy. And out of this, Bob has gone on from being a very respected Alzheimer's disease researcher to continue to be a very respected Alzheimer's disease researcher. But in addition to that, leading clinical trials, looking for biomarkers and clinical tests to detect chronic traumatic encephalopathy in living individuals, and doing longitudinal studies at Boston University in individuals at high risk for CTE, so that we can begin to understand the clinical profiles in a better way and have a better shot at perhaps, especially through the biomarkers, of making diagnosis of CTE in living individuals, something that we cannot do as of today. Chris also, in the sense of needing this brain bank, we went and found basically somebody who had been studying the abnormal hyperphosphorylated tau protein that is the hallmark of chronic traumatic encephalopathy, Its distribution in the brain is unique to CTE. Anne McKee was an associate professor at BU. She was at the Bedford VA Hospital where she worked through the VA system, had an interest in abnormal tau deposition, and had a brain of a boxer, Paul Pender, who I actually had seen box when he was a middleweight champion in Boston. Paul Pender had retired at the age of 33 and by the age of 50 was demented and died in a VA hospital, and his brain was under the process of being studied by Anne. When essentially this center was put together, what she's done is nothing short of absolutely incredible. She's gone on to become, in the last 8 years, the world's authority on chronic traumatic encephalopathy, the leader of the largest brain bank in the world with chronic traumatic encephalopathy with over 200 brains. Chris Nowinski is responsible for having gotten those early brains, and later on, now the feeder system is pretty much in place. I've always had a tremendous interest in brain trauma, not only in adults, but especially our children. I've always been concerned that I see across the desk from me individuals whose lives have been put on hold, and some of them are not going to get back to being just quite the person that they were before. And I have no doubt that we have a serious issue of many individuals who, as a result of repetitive brain trauma at a very early age, have their plateau of cognitive development somewhat arrested and may have picked up some behavioral and mood issues in terms of impulse control, in terms of panic attack, anxiety disorder, and depression as a sidelight of that. Because of that personal experience, we wound up trying to impart that knowledge about concussions and about post-concussion syndrome, and a little bit, but not the major focus, about CTE in a book called Concussions in Our Kids, which was directed to parents, trying to let the parents be advocates for their kids through knowledge. And in that book, because the young brain is not a mirror image of the adult brain, the young brain is distinctly different in many different ways. It's not myelinated. Myelin's like the coating of a telephone wire. It helps transmission, gives greater strength. So if you violently shake a young brain, which is what happens, as you all know, with concussion, it's not just a metabolic injury in many instances, it's a structural injury, tearing axons as well. The young brain is housed in a big head. Our heads reach 90% of adult circumference by the age of 5. Grows very little after that. Our necks, though, have reached only about 40% of their height, and they are very weak. And that bobblehead doll effect that is in essence there in very young individuals puts the brain at greater risk as well. The young brain's greater risk for the excitotoxic shock of second impact syndrome and what we see with concussion. And youngsters, of course, do not have informed consent. They really don't understand, the very young ones, what they're undertaking when they take repetitive brain trauma. And there is no brain trauma that's good for the brain. You cannot help the brain by hitting it. You can only hurt it if you hit it too much. Let's not get paranoid. We're all going to have brain trauma. We're all going to have to deal with that. And a brain is very well protected, generally speaking, but it's not protected infinitely. As a result of doing the book, we strongly put some things in it that we advocate, and we realize that this is not evidence-based yet, although everything is pointing in that direction. We suggested that under the age of 14, it would not be a good idea to play football at the tackle level. In the old days when I grew up, nobody did anyway. We all played flag football, and when we got into high school, that's when tackle football took off. In the last few decades, it's become more and more common that youngsters get started as early as 5 years old with tackle football. Thought that was a very bad idea. Thought it was a bad idea to be heading soccer balls at a very young age for the same reasons as tackling in football. You can, by the way, learn the techniques of the sport, tackling dummies. You don't have to bash heads. And the same thing in ice hockey. You should not be full body checking under the age of 14. When we started the book, it was 11 that was the age for full body checking. It's now risen to 13. It's essentially up there pretty much where we feel it's much safer. And as Bob Stern will elaborate in much greater detail, I'm thrilled that the work that he is spearheading and dragged some of us along with, looking at the longitudinal studies in former NFL players, that those that started playing tackle football under the age of 12 have a threefold greater chance for mood and depressive and cognitive impairment as adults than those that started at a later age. If all the evidence about concussions isn't enough to get somebody's attention, what should get everybody's attention is the research that's beginning to flood out in the last year and a half, that's focused on subconcussive trauma, that's focused on just repetitive violent shaking of the head, but no clinical symptoms, at least clinical symptoms that were recognized. I believe more likely than not there were concussions in some of this work that I'm going to quickly mention, but at least none were recognized, and so theoretically at least, this is just repetitive head trauma in which individuals from different sports, most of it's been in football, most of that football at the high school level, but not all of it, some at the college level. There's also been a lesser amount involving soccer, and a lesser amount involving ice hockey, which compared individuals preseason with postseason. And different modalities were used to compare them. In some case, it was neuropsychological tests, cognitive-based neuropsychological tests. In other cases, it was structural integrity of brain fiber tracts, diffusion tensor imaging fiber tracts of the brain. In other cases, it was metabolic studies of the brain, functional MRI, looking for what was the metabolic status of the brain preseason, what was the metabolic status of the brain postseason. And in another study at the Cleveland Clinic and University of Rochester, it was looking at the brain with S100B protein and antibodies to S100B protein in the blood, which reflected breakdown barrier for it to get into the bloodstream, because these proteins, which are in the astrocytes of the brain, wouldn't be in the blood unless the blood-brain barrier was injured and broken down. And guess what? These studies have shown that individuals, just from the subconcussive trauma of a season, show abnormality in their neurocog studies, abnormalities in DTI, abnormalities in functional MRI, abnormalities in S100B protein and antibodies to it, obviously showing injury. And these studies that were mostly pilot studies are now being repeated in greater numbers, and the preliminary findings is very worrisome that those abnormalities at the end of the season are not clearing up in about 40% of individuals, at least in the preliminary data that's out of the study using the S100B protein and the antibodies to it. So just subconcussive trauma alone, if of a high enough value, numbers, can cause brain injury, suggesting that we probably ought to think very much about ways to reduce the amount of brain injury in such sports, and that we should probably be testing individuals during the season once or twice to make sure that we're not picking up some subtle changes that would be worse by the end of the season. And you can reduce the brain trauma in sports dramatically by the way you play it. Most of the brain trauma in most of the collision sports happens in practice, because you practice 3-4 times a week with hitting, and you only hit obviously once on game day. And the way that you practice the sport can be totally changed by taking virtually all of the hitting out of it. And you're going to hear a lot more about that in Sports Legacy. Chris and I are on the stump with regard to a hit count initiative, trying to drop dramatically the number of hits to the head that occur in collision sports, especially at the youth level, but at all levels. That actually has already happened at the NFL level. The last collective bargaining agreement, the NFLPA gets it. It's not the NFL that did this, it's the PA. In the National Football League, they can only hit full contact practices 14 times in 18 weeks. That's less than once a week. And they can't hit at all in the off season. And compare that with the 2 to 3 times a week that happens in college. And if you're cannon fodder for the first stringer, it's a lot more than that. And the same in high school and youth. So in reality, it's kind of ass backwards. You've got much more hitting going on in youth, high school, and college than you do in the NFL. It's been a really interesting ride, because I think taking all of this, we really need to be very, very sensitive and do everything we can to take brain trauma out whenever we can. But I also believe, and firmly believe, that we need to do very competent, very honest, and very detailed studies as we go forward to try to prove all of these recommendations statistically and make sure that it's really going to happen. And I'm really very pleased that we've been asked to be recently a senior advisor to Attorney General Satcher's youth concussion group that will be over the next 2 years doing prospective studies in this arena. But I hope I haven't bored you too much with all of the meandering. I kind of want to set the table for a very exciting day. You have many speakers, many of them very close personal friends like Neil and Bob, and everyone who you're going to hear from today is an expert in their own arena, and I applaud you again for taking time out of your busy work week to be here. Thank you.